I wanted to talk to you about some of the differences between the medical approach to leaky gut syndrome, irritation in the digestive tract, and more of some of the functional medicine or natural medicine approaches to stomach problems. Everybody, medical doctors, naturopaths, chiropractors, nutritionists, we're all wanting to help. But due to the training, we have different approaches. I have seen a lot of times people come in with stomach problems, and they've been to 10 doctors. And this is what they share with me that's been done. They say, I've got some stomach problems. I know I've got some stomach problems. And so I went to the medical doctor, and this is what I hear that the medical doctors are doing. They'll run, they'll do maybe a blood test to see if standard things look normal. Yep, came back looking mostly normal. So then it looks like the second test that's run is, let's give you an endoscopy or a colonoscopy. Now what that is they're going to give you some anesthesia, and they're going to put a tube down your throat, which is endoscopy, and they're going to be recording it and looking, and kind of directing this tube. You have to, be knocked out, and they're going to be looking for anything that's big and obvious, and looking for, holes, ulcers, giant, wow, I can see this with my eye. Colonoscopy is the same thing, but they're coming through the rectum. They're coming up into the large intestine and looking, same thing with the camera, and you've got to be under anesthesia and knocked out. So they're with this camera, video recording it, of course, looking to see if there's anything big and noticeable that's wrong. Oh, you're bleeding. Oh, there's a giant hole. Oh, there's this giant polyp. Wow, this is something you can see with the naked eye. So I find that there is some middle ground stuff that is missing big time between, let's run just a simple blood test, and looks like everything okay, let's do a colonoscopy. There's something that should be done before you jump into the colonoscopy, endoscopy. In my opinion, there's some weaknesses with these two tests anyway. The endoscopy and colonoscopy are super expensive, and they're looking for things that you can see with your eye. It's not looking for microscopic problems. It's looking for giant structural problems that can jump out and go, whoa, okay, we see this, it's so big I can see it with my eye. Most of the problems in the intestines, in my opinion, are not visible with the naked eye. So you need to do some testing for some of the other things that cause troubles in the digestive tract. You need to check for food sensitivities, food allergies. You need to check for low-grade infections that can hang out in the intestines, and you need to run some specific tests for those. Those tests for infections that live in the intestines are not going to be usually a blood test. It needs to be a stool test. When was the last time a doctor ordered a stool test for you? It's very, very rare that it's done. Or if you're in applied kinesiology, neurofeedback type testing, you can test for low-grade infections that way. But there needs to be some type of testing for stomach infections, and just a blood test doesn't cut it. Also, you need to check to see if there's some nutritional deficiencies for promoting the healing of the intestines. You need to check for some of these toxins that could be in the body. So these things need to be tested for, and blood test, then jumping to colonoscopy skips all this stuff. And then we could get into the differences in the treatments, but the testing for stomach problems, leaky gut syndrome, is quite different schools of thought for what to test for. So I think there's a lot of middle ground stuff that could identify what's the causative factor of your stomach problems with checking for some of these other tests. I don't think that just a blood test, or then let's jump into endoscopy, colonoscopy, is the correct linear line of doing the tests. So we need to get some food testing for what could be causing troubles. We need to get some low-grade infection testing. We need to check to see if there's any nutritional deficiencies, gallbladder function, various things that could be tested for also that I think are missed in general. So if this rings a bell for you, if you know someone who's got some stomach problems, leaky gut, bloating, various symptoms that this might be of interest to them, please share this video. If you have some questions, please comment below. I'll do my best to answer your question or make another video about it. Hope you're liking this series of things about stomach problems and leaky gut syndrome.